Hey guys, it's Amy with Too Blessed. I'm here today to talk to you about another one of my health conditions, and that one is called gastroparesis. Um, the gastroparesis is one that has very, very much impacted my life. It has changed a lot of things, and um, I just wanted to talk about it because it's not very well known. And so I just want to go ahead first and just kind of tell you a little bit about what gastroparesis is, and then I will tell you about how it affects me and sort of my story about it. So gastroparesis, that word, it literally means gastro refers to your stomach, and then paresis is where we get the word paralysis. So it literally means paralyzed stomach. Like I said, it is very rare. There's fewer than 200,000 people that are diagnosed with gastroparesis. There is no cure for it, and there are very few treatments, and most of the treatments are not even very effective. So it's a very challenging disease. The main symptoms for gastroparesis, and it's different for everyone. Not everyone has all of the symptoms. So I'm just going to list off the common symptoms, and then later I'll tell you about the ones that I actually have. So the common symptoms of gastroparesis are nausea and vomiting, abdominal pain, fullness after eating just a very small amount of food. Like after eating just a few bites of food, you might feel like you've eaten an entire Thanksgiving dinner. Heartburn, bloating, lack of appetite, weight loss, just a lot of those types of issues. Diarrhea and constipation usually go along with that as well. Gastroparesis, there's basically two main types of gastroparesis. There's diabetic gastroparesis, which is what I have. And then there's idiopathic gastroparesis, which technically means they don't know the cause of it. But there's a lot of different things that can cause it. Basically, gastroparesis is caused because the vagus nerve, which runs to the stomach, is damaged in some way. Now, in diabetes, that vagus nerve is damaged because of the blood sugar being high. And your blood sugar being high causes damage to a lot of the nerves in your body. But it could also happen, some people have had an abdominal surgery, and that vagus nerve gets damaged during the surgery. Some people get it, they might pick up some type of a virus, and after the virus is gone, they end up with gastroparesis. So there's a lot of different things that can cause it. And then again, there are still people that have gastroparesis and the doctors cannot figure out why. Gastroparesis can cause a lot of complications. For people with diabetes, it can cause very erratic blood sugars, and it does that for me. It can, of course, cause malnutrition because of the lack of appetite, and then also there are some dietary sort of restrictions or recommendations that they give us. It also causes very severe fatigue, and then we're also at greater risk for intestinal blockages as well as bacterial infections, because when things sit in your stomach for a long time, that gives bacteria a chance to grow more than it does in a healthy person. So basically what happens in gastroparesis, like I said, your stomach is paralyzed. And so your food just does not digest, or it digests very slowly, which is the case for me. Some people can take literally days for something they eat to actually digest. Some people, it just takes maybe hours the rate of digestion is different for every person that has gastroparesis. There is a test that they do where they have you eat food that has markers in it, and then they scan your stomach every so often, watching to see how quickly your body digests. And that test is basically how gastroparesis is diagnosed, is they watch that food go through and they see how long it takes your body to digest. Now, the big problem with that is that even when you have gastroparesis, your digestion can change from day to day even. Like one day it might be, you might digest normally, and then the next day it might take you 3 days to digest. It's very erratic, and it's very hard to treat because of that, because you might have that test done and it might show that you're normal, but you actually have gastroparesis. So that's one of the reasons that doctors have such a hard time with a condition like gastroparesis. But then also just the fact that even a lot of doctors are not knowledgeable about this condition. Many of them have never really heard of it. Most of them have never seen a patient that had it. Most of them don't know what to do. So we really want to raise awareness for this condition and just try to get information out there so that people are more aware of it, and that more doctors and medical professionals will know how to help us when we come to them. So like I said, there are not really restrictions for gastroparesis, but the doctors do the best they can to try to determine which foods are harder to digest than others. And they recommend that we avoid certain foods that are more difficult to digest. For instance, fiber. Fiber is very hard to digest, and eating too much fiber could be a cause of those intestinal blockages that I talked about. It can actually cause the food that you've eaten to harden up as it tries to pass through your intestines, and it can cause a blockage. So they usually recommend that we try to avoid eating too much fiber. For myself, I usually try to eat less than 3 grams of fiber at one time. And then also raw fruits and vegetables are hard to digest, especially ones that have skins or seeds in them, because seeds and nuts are very hard to digest. And then also red meat and things that are very high in fat can actually slow your digestion down. So it's usually recommended that we follow a low-fat diet. So for me, that means, especially with having diabetes at the same time, it makes it very difficult, because what they recommend for someone with diabetes is to eat high fiber, to eat a lot of fruits and vegetables, and those are the things that I have to avoid. So it's very, very hard. It's very challenging to try to balance what I should be eating with what I can eat. Like I said, gastroparesis can cause you to have a very low appetite. Today, for instance, I'm actually filming this at night because my husband has started working third shift, and he sleeps during the day, so I didn't really want to film during the day and risk waking him up. So I've been filming at night. So like I said, right now it's about 10 o'clock at night, and so far today I've eaten cheese and crackers and a grilled cheese sandwich. That's all I've been able to manage today. And that's not enough food, but that's all I've been able to eat. And that's actually a good day for me, because there's a lot of days that I eat even less than that, or I eat nothing. So, and you probably wouldn't believe that to look at me. As I said, one of the more common symptoms of gastroparesis is weight loss. However, for me, I have actually gained weight. I mean, like I said, that the amount of food that I ate today, that's a pretty normal day for me, really. And so you would expect to look at me and see a very tiny person, but for me, like I said, it causes me to gain weight. Now, I also have extra weight that I carry because of one of my other conditions, which is I have kidney failure. And that has caused me to retain a lot of fluid. So it's kind of a combination for me. I've gained weight because of the gastroparesis. Excuse me. But I also have gained some weight from my kidneys not filtering that fluid out of my body. Actually, when I first started getting sick, I had just lost a lot of weight because I used to be quite heavy. I lost a lot of weight and I was down to about 130 pounds. I was about a size 6 to 8. And actually, when I first started going to the doctor to try to figure out what was going on with me when I was starting to feel sick, she told me at that time, she said I needed to be careful not to lose any more weight. But it was really shortly after that that my weight started just kind of creeping up and creeping up and creeping up. So I've steadily been increasing over the last about 5 years. So I just, oh, okay. And then I made notes, but I'm not following them. So for me, my symptoms, basically, of course, I have the nausea, I have the vomiting, I have the diarrhea and constipation, TMI, I know, which alternates. You know, I can, one day I'll be constipated and then the next day it's diarrhea. The worst part about the diarrhea is, this is embarrassing, but it gets to a point where it's kind of uncontrollable. So it's really hard sometimes to like go out in public, because you just don't know and you can't control it. Like I said, I know I've had people comment, you know, asking why I can't go certain places or do certain things, or, you know, things like sometimes I'll miss out on an event or something like that, and sometimes I'm not necessarily sick, but there are just times when you can't leave your house, you know, when you're vomiting and you've got things like that going on, you can't, no matter how much you want to. And you know, it does affect my life. I've missed out on a lot of things because of it. I do deal with a lot of bloating. Right now, my stomach is very bloated, and it can go even from one day to the next. One day it can be pretty flat, and then actually today it's not quite as bad as it was yesterday. Yesterday it was out pretty far, and you know, if I turn sideways and look in the mirror, I look about 9 months pregnant. Not exaggerating. Not exaggerating at all. Right now I probably look about 7 months pregnant. So it's down a little bit from yesterday, and the bloating can be painful, you know, when your stomach stretches out that far. That can hurt. Like I said, I do suffer from the lack of appetite, the feeling full after just eating a very small amount of food. The pain for me is not too bad. It's not constant. It actually used to be a lot worse. I used to suffer from the pain very badly. But then actually they took my gallbladder out, and I believe that was a cause of quite a bit of my pain in my case. I know that's not everybody's situation, but for me, when I had my gallbladder taken out, it did actually get rid of quite a bit of the pain that I was experiencing. Now, since then, I really only have pain when I have an episode where I'm vomiting a lot. I also have something that's called cyclical vomiting syndrome. And when that kind of flares up, I will vomit, and then even though I don't have anything left in my stomach, I will just vomit and vomit and vomit. And then if nothing's coming out, it'll just be dry heaves, but I can't stop it. And that's when I usually get pain. And I usually get like a feeling like someone is squeezing my stomach. Just this really, because you can, when your stomach just contracts like that over and over, that causes a lot of pain. I'm trying to think now if I missed anything else. Basically, so like I said, gastroparesis really affects every single day. It affects almost every minute of your life. Most days when I get up in the morning, I feel sick. At least a little bit of nausea. Now, I have found recently that when I get up, if I can get a little bit of food in myself, I usually start to feel a little better. But it doesn't always work. Sometimes I'll try to get a little food in myself and it comes right back up. But a lot of times, if I can get something down first thing when I get up, that does help. For me, it kind of ends up being sort of like a very severe case of morning sickness. I'm talking like the worst kind of morning sickness you've ever had, and then even worse than that, maybe. It's pretty bad. So usually mornings are the worst time, and then as the day goes on, I usually start to feel a little better. By evening, I'm usually feeling pretty good. And then, there's days that I feel bad all day. So there's no way to predict what a day is going to be like. That's for sure. So then the other thing I wanted to talk about is I just want to kind of go down the timeline of when I started feeling sick and how we finally figured out what it was and what we've been doing. So basically, when I really started noticing it was probably in the spring of 2011. Now, since I've been diagnosed and since we figured out what it was, looking back, I could see that I had a lot of episodes of like getting a stomach bug, but it would, I'd get sick for a couple days or a day here and there. But I did seem to get that a lot more frequently than most people, but I never really thought about it. So spring of 2011 was when it kind of seemed like things just started getting a little bit worse. The episodes kind of started getting more frequent. Then I want to say the first thing that I really noticed was actually the diarrhea. I had several episodes where like I would be out in a public place and I would have to rush to the restroom and either not quite make it or almost not make it, but it only happened once in a while. But I was like, wait a minute, this is not right, something's going on. So I tried some things that fiber, which turns out was probably a really bad idea. At the time that it first started, I wasn't working. I was looking for a new job. I ended up getting a job at Walmart, and I had to wait a little while because when I started out as part-time, and then after just a little bit, they switched me to full-time, but then I had to wait another 30 days for the insurance to start. So I had to wait a while before I could start going to the doctor to figure out what was going on. But, while I was working, I had a few episodes where I would be at work and just all of a sudden I would get sick. I'd just be working and all of a sudden I'd get sick. I'd go to the bathroom, I'd get sick, and then I'd usually come back and feel okay. but it just kind of gradually kept happening more and more frequently. When I finally did get to start going to the doctor, I met with a nurse practitioner, and she was really nice. I really liked her. And when I told her all of my symptoms, she said, I'm pretty sure it's your gallbladder. And I really had thought the same thing. I had, in the past, I worked for a health insurance company for quite a few years. And then I also, before I started the job at Walmart, I had been studying medical transcription. So I had a background in medical things, and I knew a lot of medical terminology and things like that. So I was familiar, and I researched my symptoms, and every symptom I was having matched like 100% with gallbladder. So we both were just sure that it was my gallbladder. And so she scheduled for me to go have the HIDA scan done. And I went and got that done. And of course it came back no problem with the gallbladder. So she was kind of at a loss. So we went ahead, and then she scheduled a colonoscopy. They did the upper and the lower at the same time, because she thought, let's just take a look and see what's going on. So I had that done, and when I went to that doctor to get the results, he said everything looked fine, and he diagnosed me as having irritable bowel syndrome and told me that I would just need to learn to live with it. And that was kind of the end of it. And I was extremely frustrated with that, because I knew, if it was just constipation and diarrhea, I could have understood if it was irritable bowel syndrome, but I never heard of anyone with irritable bowel syndrome that vomited all the time. That just didn't make sense to me. So I ended up going back to her, to the nurse practitioner, and we really never did go any further with any testing at that point, because I kind of just thought, well, I guess I will just try to learn to live with it. I decided I would try some things on my own. I kind of suspected, she did some blood work to check for like celiac disease, some other things. I can't remember what all she checked for. And those all came back fine, but I thought, well, maybe I'll try a gluten-free diet. Maybe I'll try this other diet. I tried some things like that. Now, in the last video that I posted, I talked about the trouble that I had with my eyes. And this all was kind of happening at the same time. So after I had that colonoscopy done, and he said, like, oh, everything's fine, you just have to learn to live with it. That was when the eye things started coming up. And so we started concentrating on my eyes, getting those treatments done, getting the surgeries done and things like that. Sorry, my dog was barking. I got distracted. So I started getting all the treatments done for my eyes, and really it seemed like the gastroparesis just kind of calmed down for a while. I didn't have too much trouble, just every once in a while, but not really too much problem. So that was, like I said, it was spring of 2011 that this all started. Now, during the summer of 2011 was when I met my husband. I am going to do a separate video on that too. We actually met on eHarmony over that summer, and we were talking, and through the fall, we ended up getting engaged in February of 2012, and then we got married in June of 2012. So during all of that time, from like the fall through the winter into the spring, I really was not having terrible issues. Like I said, it would just be here and there, a day or two. It was tolerable. I was still able to function and do what I needed to do. So I just really kind of didn't think about it much further. Um, Now, my husband, when he was my fiance at the time, he he's just such a sweetheart, and he would say, I'm not going to let this go. He said, when we get married, I'm going to find the best doctors. We're going to find out what's going on. And he truly kept that promise. So when we got married in June of 2012, I had a few months there where I was really pretty good. Like I said, I still had episodes every once in a while, but it wasn't really terrible. I ended up in August, towards the end of August, we got pregnant, and I had the most horrible morning sickness. I was just miserably, miserably sick. And it was one of those, it wasn't morning sickness, it was all day sickness. I don't want to go into too much detail right now, but we did end up losing the baby in November. And like I said, that entire, from August to November, I was just so extremely sick. So sick. After the miscarriage was when things really, really got bad. There was a short period of time where I was a little bit better because the morning sickness part was over, and I was doing okay, not great, but I was doing okay. But it seemed like it pretty quickly progressed after that. I think my husband calculated that, so basically from probably about 2013 until, I think this was sometime last year, that he figured that out, that I was in the hospital about 60 times trying to get help with this. If you've seen the movie Miracles from Heaven, the little girl in that movie, now her condition was a little bit different than gastroparesis, but her symptoms and what they went through to try to get her diagnosed was very similar to what I went through. And in fact, when we were watching that movie, Steve would keep saying, "That's what they told you. That's what they said to you. That's what they did." So if you, like I said, if you watch that movie, then you almost know my story. There's a lot I could tell, but I'm going to try to condense it down a little because I know this is already pretty long. Basically, we went to a lot of GI doctors. And it just seemed like nobody wanted to help us. Nobody wanted to take time to figure out what it was. Actually, my primary care doctor, who I really like, he's an amazing doctor, I think. He actually had suggested that possibly I had gastroparesis, and that kind of triggered my husband to do some research. And he started reading about it and looking into things and trying to figure out what we could do. It all runs together now when I try to remember, but I know that at one point I was in the hospital and I was incredibly sick, and they wanted to try to do that gastric emptying scan on me. And I remember they took me down to do the scan, and I had to eat oatmeal. And if you're nauseous and you're vomiting and somebody tries to make you eat oatmeal, that just doesn't work. So I remember they did that test, and it didn't work. I ate the oatmeal, but it didn't stay down. So I ended up going to a different hospital at a later time and did the test, and they did confirm that I had gastroparesis. We tried some different medications. Nothing really helped. Pretty much all anybody wanted to do was just give me anti-nausea medicine and just send me home. It felt like they just really didn't care. They really didn't want to put any effort into trying to help me. In fact, going back to the fact that doctors say that gastroparesis doesn't cause pain, there was one episode where I was in the hospital, and when I got to the hospital, they asked me if I was in pain, and I said yes, I was in pain. And it was bad. I think I told them it was an 8 or a 9. They always ask you on a scale of 1 to 10. So I think I said it was an 8 or a 9. And they gave me pain medicine. Now, apparently, pain medicine slows your digestion. But they didn't even ask me if I wanted it. They just asked if I was in pain, and then they gave it to me. And it was pretty strong, and I was kind of passed out almost from it. And the GI doctor, I remember my husband was at the hospital with me, and he had just left the room to go get something to eat. He wasn't gone more than a few minutes. I was asleep, and the GI doctor came in the room, and he came over to the bed, and he grabbed me by the arms, like on both sides, and shook me until I woke up. And then he yelled at me, and he said, "Why did you take pain medicine? Are you a drug seeker? Are you just here for the drugs that we're giving you?" And I don't even remember what all he said. I was in shock, really. And I couldn't really talk. Like, the pain medicine had kind of knocked me out so much that I couldn't make myself talk to him and answer to him. But I was absolutely shocked. That was pretty much the most horrifying thing that ever happened to me in a hospital. I couldn't believe that for one thing, a doctor would come in the room and put his hands on me. But then, that he would yell at me when I didn't have any choice over what medicine they gave me. But anyway, I digress. So, that's a pretty common struggle that people with gastroparesis go through, is that when we're having an episode that, if you can't keep down even a sip of water, then you can't get your medicine down. And that anti-nausea medicine isn't going to help you if it doesn't stay in your stomach. So at some point we have to go to the hospital, and then we get treated as if we're drug seekers. That's a pretty common thing, to be treated that way. And it's terrible. Nobody should be treated that way. Anyway, so back to the story I was telling. So my husband started doing research. I really am trying to condense this down. He started doing a lot of research, and he found out about what is called a gastric stimulator. It also sometimes is called a gastric pacemaker, different names like that. It's basically the same principle as a pacemaker for your heart. It is implanted in your body. There are electrodes that are put on the stomach, and small electrical impulses are delivered to the stomach to try to cause the stomach to contract and help it digest the food. So he found out about this, and we asked the GI doctor that I had at the time, and he told us that they would do those implants at Vanderbilt University, but he said it's a 3-year wait to get in to see them. So basically he just told us, forget about it. Well, my husband, he doesn't forget about things like that. He doesn't take that as an answer. So he started doing more research, and he actually found a doctor in Knoxville who did the implants, and he was able to get me in pretty quickly. So we went to see him. We had to try a few other medications first, because they had to try everything before they would approve the surgery, as far as insurance goes. So I tried a few medicines. We waited a while, and nothing really helped too much. So we ended up going forward with that. I had to get my gallbladder taken out first. And taking the gallbladder out really did help with my pain in in my case, I know it doesn't do that for everybody, but for me, it did make a difference as far as the pain, like on a daily basis. And then eventually, and I believe it was April of 2015, we had a few hurdles getting there, but it's been almost 2 years now that I got the gastric stimulator implanted, and it has helped. It certainly has helped. It took about a year to get the settings correct, because what it is they start out with very low voltage, a very low rate, and then they can slowly increase it to see, the more they increase it, the more that it helps. So it took about a year to get it set to where it really does help me. Right now, with having the stimulator, I actually do have days where I'm not nauseous. In fact, I have, every once in a while, I have a day where I feel pretty great. I do still have days that I feel sick. But I don't really vomit very much anymore. Like I said, it does still happen when I have like what we kind of consider a flare-up. So, from day to day I'm doing better, but I do still have like episodes where I get worse. And I do still have episodes where I might have to end up in the hospital. But they're much fewer than they used to be. So I'm very, very thankful for that stimulator. It has made a huge difference in like my quality of life. Now, like I said, there's no cure for gastroparesis, but it definitely has improved the quality of my life and made me able to have somewhat of a life, even with gastroparesis. So I'm sorry that this video was so long. I really didn't intend for it to be, but I just wanted to try to get all of this information out there. Again, if you have questions for me, if you want to know something about gastroparesis, if you want to share your story about gastroparesis, join me in the comments below. I love getting comments. If you're new here, I would love to have you subscribe. Down below the video, there's a red subscribe button, and I would just really love to have more subscribers and be able to make my channel grow. So thanks for watching, and I'll see you